Hello everyone, it's Dr. Grace. Welcome back to the channel. Today we're talking about something that is kind of hard to talk about, or perhaps not hard enough. Yes, we're talking about erectile dysfunction today. We're going to talk about what causes it, what to do about it, and how you don't have to just accept it as your fate. So let's go straight to the point. If you haven't liked or subscribed, now would be a good time to do it. What is erectile dysfunction? Erectile dysfunction is when a man struggles to get or keep an erection firm enough for sex. It is also called impotence. Yes, that's right. Impotence does not mean infertility. Impotence and infertility do not mean the same thing. Impotence and erectile dysfunction do mean the same thing. So erectile dysfunction, or ED, is super common, like way more common than you think it is. It's just that men don't really talk about these things much. It is so common that more than 30 million North American men experience erectile dysfunction at some point in their lives. It's way more common than you think. So if you're dealing with this, then you're not alone. And guess what? You don't have to just accept it as part of getting older. All right, let's talk about why this happens. So ED can be caused by a bunch of things, okay? But we're talking about the top contenders today. Number one top contender is medical conditions. So the most common culprits in this category are diabetes and high blood pressure, and we have talked about them in previous episodes on this channel. You can check them out if you're interested. But diabetes and high blood pressure cause, in the simplest terms, they cause damage to blood vessels, and this can restrict blood flow and cause erectile dysfunction or impotence. Number two with our top contenders is mental health stuff, so like anxiety, for example, performance anxiety. And this is actually a really top contender, because once a man has had difficulties getting or maintaining an erection enough for sexual intercourse, this can affect his confidence and just compound the problem as time goes on. So if it's happened once before, he's more anxious, he's more nervous about trying again. He doesn't want to be seen as less by his partner, and this just compounds the problem. He either doesn't try again, or he tries again but can't get out of his head enough to actually maintain an erection at that time. So we call that performance anxiety, and that's actually really common. So number three contender today is medications. So the big culprits in this area are antidepressants. It actually is quite stressful to find one that doesn't cause erectile dysfunction, but it is possible. Sometimes you just have to kiss a few frogs before you find the prince. So sometimes you need to switch your antidepressant medication. This does not mean that you should stop taking your medications without talking to your doctor, but some antidepressants are big culprits in causing in being party poopers in the bedroom. Other medications are like medications for diabetes and medications for high blood pressure. Sometimes they can also be party poopers in the bedroom. So definitely be talking to your doctor about any of your symptoms, okay? Number four top contender is lifestyle. Heavy smoking, heavy alcohol consumption, recreational drugs, lack of exercise. They do not help, like, at all. Number five contender today is sleep problems. So poor sleep, which can be caused by a host of other things, and also sleep apnea. Obstructive sleep apnea can be causes of ED, mainly because your body needs to rest to be able to perform its best, and also because it can be a symptom of other conditions. Number six contender that we're talking about today is hormone issues and nerve issues. So I'm just going to group them into one. Hormone issues like low testosterone can cause problems in the bedroom, and nerve damage issues, so from like neurological conditions like multiple sclerosis, for example, or if you've had any surgeries around that area, could have damaged a nerve, and that is also one of the causes of ED. All right, the part you've been waiting for. What can we do about it? Hint, there is hope. So the first thing that you want to do, and you know I'm always talking about this, is lifestyle changes, okay? You need to cut down on the smoking. You need to stop smoking, actually. You need to cut down on the alcohol consumption. It is not good for you in any way, shape, or form. And I'm being very blunt with you here, okay? Cut down on the drinking. You need to move your body more, exercise, include some weight training, okay? Eat better. Your heart and your bedroom life will thank you for this. Thank you for your service. Okay, second of all, you've probably heard of medications like Viagra and Cialis. Sometimes Viagra is called the blue pill. So if you haven't heard of any of them, you've probably heard of the blue pill. These pills can help to increase the blood flow so that you'll be able to get and keep an erection enough to have sexual intercourse. But you should not just take this medication anyhow. You should talk to your doctor about it, because some people cannot have those medications. The third thing that we're going to try is managing stress and anxiety. So if you've had performance anxiety, you've had plumbing issues, so to speak, before, and you're feeling anxious about trying again, how about speaking to your partner? Just being open about what happened can be really healing, and you'll be able to navigate the bedroom better after this. So don't be shy. Remember, there's 30 million other men in North America alone who are feeling what you're feeling. So you are not alone. You're not the first, and you will not be the last, as my mom always says. If you're still struggling after speaking to your partner, then you should speak to your doctor about it, because it could be any of those other things that we mentioned before, okay? Like high blood pressure, diabetes, so you need to be getting blood work. You need to be having a medical professional monitor this. If everything's okay, therapy is an option, okay? You need to be able to talk to a specialist. There are sex therapists out there who can walk you through this difficult parts of life. Another thing that you can do about it, again, who can guess the answer here? Because I think we've talked about this so many times. Yes, speak to your doctor, okay? If you're diabetic and you're doing therapy and talking to your partner only without treating the diabetes, then it's just not gonna improve. If you have high blood pressure and you're doing other things apart from actually treating the root cause, which is high blood pressure, it's not going to change, okay? I know that sometimes there's a combination of factors. You can't get it up because you've got diabetes and then you get performance anxiety. So sometimes a well-rounded combination of treatment options is what's available. Always, always, always speak to your doctor. There are newer forms of treatment on the market now, like vacuum treatments, which are not as scary as they sound. There's even surgical implants now. There's some people who need shockwave therapy. Most people are not as severe as any of these cases. Most people will be successfully treated for this, okay? So speak to your doctor first before you panic, all right? I hope you've enjoyed this video. If you have, please leave me a thumbs up and a comment down in the comment section below. As always, if you want me to talk about another health condition, I'm always happy to do that. Thank you for watching to the end, and I will see you in my next video. Bye.